Okay, guys, I think we'll get going as it's late in the evening. Just to confirm everyone can hear me, can somebody just write into the chat box that they can hear me okay? Perfect. Okay, thanks, guys. So we've been looking forward to this for the past couple of weeks, so thanks again for joining us. Today's webinar, presented by myself, Greg Hall, on behalf of Resync Physiotherapy. We'll be talking about working from home post-COVID-19. We'll be doing roughly a 30-minute presentation with some exercise demonstrations along the way, and also with an opportunity for a bit of a Q&A at the end. I'd encourage everyone to type into the chat box as we go along if you have any questions, or to share their experiences with working from home. I've also put in the title slide there, is sitting the new smoking? A little bit of clickbait, but we'll try and debunk that myth as well. Okay, so quickly, just about who we are here at Resync Physiotherapy. We're an established physiotherapy clinic in South Dublin. The services we offer include physiotherapy, sports performance, women's health, strength and conditioning. We do different types of rehabilitation programs, and mainly we look for guaranteed results. Our physio and athletic therapist team comprises of our clinic director, Dermot, Connor, myself, Hazel, and Sean. And then we have our brilliant admin team of Rachel and Alana as well. If you're looking for us on social media, we're at Resync Physio, and our website is listed there as well, resyncphysiotherapy.ie. So hopefully a few people are familiar with where we're based. If you're not, there it is. You can always just look it up on Google and find us on maps. And then lastly, just a little bit about myself before we start. As I said, my name is Greg. I have a Bachelor of Science in Health and Performance Science and also in Physiotherapy. I'm also currently working towards my Master's in Sports Physiotherapy at the University of Bath. I've been working as a physio for 5 years now. I've experience in both private practice and in the public hospital setting in Singapore and in Ireland. I've also worked in rugby and hurling in Ireland, and also in some professional football in Singapore. What do I like to do myself? Well, I like to play rugby, football, golf, and try and keep fit through running and weightlifting and strength and conditioning. Okay, so our learning objectives for today. We want to introduce you guys to some facts, statistics regarding working from home, exercise, and also sitting. We want to give you an intro to ergonomics and posture, and hopefully have a good understanding of those two. We want to give you some solutions to prevent musculoskeletal injuries at home. We also want to show you some exercises that you can try at home. I'm hoping that's why most people have logged on. And then also just kind of give you a brief overview of the benefits of physiotherapy and how we can potentially help you. So work from home is definitely here to stay. The poll on the right here is from the journal.ie. They had over 16,000 respondents who were asked about going back to the office. Over 60% of people are looking to or will be continuing to work from home. That's a lot more than what the president of the Global Workforce Analytics, Kate Lister, listed as 25 to 30%. But generally, what we can see is a lot of people are either looking to or continuing to work from home. So we're going to have to probably manage this situation. So if you feel like you want to share, let us know in the chat box if you're currently working from home, if you're continuing to work from home, or if you'll be going back, and what you're looking forward to as well. So there's loads and loads of benefits to work from home, okay? And I've only listed a few here, including better work-life balance, increased productivity, potentially better for the environment in terms of reducing greenhouse emissions. Some people say there's fewer distractions in home, and that doesn't even get down to stuff like more time with your family, potentially saving money on your commute and petrol, and getting to have home cooked meals, and so on and so forth. So there's a load of benefits to work from home. But there's some downsides too, okay? These might be an inability to get away from your laptop or your phone after 5 o'clock. People always saying, you have to be available. Increased screen time, maybe less social interactions because we're not going for lunch or for a coffee with our colleagues. But the main one is potentially more of a sedentary lifestyle. And we're not saying that's for everyone, but for the majority, it might be a little bit more reduced exercise, maybe some more time sitting. So this is an American-based stat, but the average time an office-based worker spends at his or her desk per day is 9.1 hours. So it's quite a lot. You might be thinking, that's not me, and I'm not saying that's everyone, but the average time, and obviously we're looking to reduce that down as much as we can. Just looking into the chat here, some people saying primarily going to be home-based, office once a week only, we'll be mixing. Okay, so a little bit of a mix, but definitely still people being at home. Okay, so is sitting really the new smoking? In reality, no, and we're going to go through a few facts here. So these are from the American Heart Association, and essentially they've summarized a lot of information there, saying that the average Americans, again, is where a lot of this data is coming from, but they do very little activity, less than 20 minutes. They watch a lot of television and they sit for a long time. And that can have lots of detriments to us in terms of an increased risk of diabetes, increased risk of cardiovascular events, and essentially increased risk of all-cause mortality or essentially risk of death from any cause. But smoking is still a lot higher. Does that mean sitting is good for us? No, but there's still a load of work for us to do on this front. So sitting for too long starts a vicious cycle that usually starts with a period of inactivity. This can result in poor mobility and movement patterns, stiff muscles and joints, injuries, aches and pains, movement and exercise avoidance, and then ultimately bringing us back to sitting for too long. So when we develop these injuries, aches and pains, that's what results in us avoiding exercise and then essentially just going back to sitting for too long. Sorry, bear with me as I just let somebody into the meeting here. Okay. So now, sadly, there are some quotes here that are not meant to scare anybody, but more just to highlight the importance of our physical health. Okay. So the first one is from Dr. Kelly Starrett, who is a physiotherapist, again, based in the US. And he said that the typical seated office worker has more reported musculoskeletal injuries than any other industry sector, including construction, the metal industry, and transportation workers. So if people are unaware, musculoskeletal essentially relates to the muscle and bone system, right? So lots of tissues in our body. And this is probably the opposite to what we would think in terms of laborious jobs versus non-laborious jobs. And what we're seeing is there's actually more people presenting to physiotherapy with non-laborious jobs. Next, we have a study from the British Journal of Sports Medicine. They did a study with over 4,500 adults who reported their sedentary levels, sedentary being non-exercise related activity. What they found was that prolonged sitting significantly increased a person's risk for diabetes and heart disease. And those that sat for more than 8 hours had a 68%, were 68% more likely to have some form of cardiac disease. And this increased risk was present in subjects who reported as little as 4 hours sitting per day. Now, sure, most people do 4 hours a day. I personally do myself. So we need to take that with a pinch of salt. In the International Journal of Behavior, they looked at university students, but they found that people who partook in vigorous exercise for more than 60 minutes a day were actually 29% more sedentary on the days in which they did this exercise. So of course, it's brilliant to get out early, get our exercise in, but it's not an excuse for us to go and sit then for the rest of the day. We then have the Journal of Public Health, who looked at 10,000 subjects between 35 and 55, and they graded their activity as low, medium, or high. The lower your grading, the more likely you were to have lower cognitive performance. Cognitive performance essentially meaning your brain's performance. Those in the low activity group were most likely to have poor fluid intelligence, which is classed as the ability to think logically in novel situations. And this was just kind of backed up by Dr. John Ratey from the Harvard Medical School, who said that the brain responds to exercise like your muscles do. It grows with use and withers with inactivity. What is even more disturbing, and what no one realizes, is that inactivity is killing our brains, physically shriveling them. So again, he's pretty direct and to the point there, but it does kind of make sense. And the last one I'll share with you is one from Dr. Frank Forenchich, who is an internationally recognized expert on health and human adaptation. And he looks at anecdotal behavioral movement patterns. And again, this quote is very direct, but not necessarily incorrect. He says the human body, living in the midst of the greatest health opportunities in human history, has become weak, dysfunctional, and physically illiterate. And what he's getting at here is that never before have we had so much information around what we should be eating, how much exercise we should be doing, different fitness trackers, programs, online classes, YouTube, sports teams, whatever it might be. We've never had as much at our fingertips or in front of us. And yet we still seem to be running into trouble and health disability when it comes to our exercise. So the ramifications of sitting. The main things we would look at from a physiotherapy perspective would be your ergonomic setup, which we'll discuss later on. But how we sit and set up can have profound impact on our posture, our muscle flexibility, our joint mobility, our muscle strength, and how we perceive pain. On top of that, there's the MSK and non-MSK problems shown on screen, which we kind of already mentioned, like the brain fog, heart disease, diabetes, lower extremity problems as well. So how heavy is your head? Might seem like a random enough question, but if anybody happens to be on their laptop like I am, try to lift up your laptop, okay? Most laptops weigh around 1 kilogram. So if you multiply that by 4, that's going to be the weight of your head. You might have seen some reports in the past relating to text neck from being on your phone and potentially that having permanent changes to your posture. This thankfully isn't true. However, over time, your muscles and joints can have adaptive changes. And this can lead to a little bit of a forward head posture, but it doesn't mean it's non-reversible. Kind of like it's kind of the opposite of what we would see with elderly people where they're very flexed over. As we get older, this might be related to a lumbar injury, pathology, or osteoporosis. But with that said, many years of one position can have profound effects on our posture and our overall health. So common muscle groups that we would again look at that would be affected by sitting and this kind of prolonged posture include our neck and our shoulders, even our anterior chest, definitely our low back and our hips, and even our knees and hamstrings as well. So essentially most of them, but we're going to look at some exercises to combat these later on. All right, so here is a graphic from the Irish Health and Safety Authority. These were guidelines published last year in response to the pandemic. And this is what would be termed optimal in terms of your chair and monitor. What I want to really see is this sustainable? So in relation to your seat, they advise that the desk is just to be underneath your forearms, hands, and wrist, your forearms parallel to the floor, your thighs to be supported on the chair and parallel to the floor, and that your thighs, knees, and backs of the leg are clear of surfaces. I assume they mean clear of surfaces being the underside of the desk or something in front of you. They also suggest that you sit upright all the way to the back of your chair, sit facing your work area with your shoulders relaxed and head naturally balanced. In terms of the monitor, you can see that they say the screen to be an arm's length away and the top of the screen is slightly below eye level. They also recommend avoiding twisting and positioning your keyboard and mouse next to each other so that your elbows are not too close to the body. And then in the corner, they recommend to take breaks and stand and move about frequently. Now, in my opinion, they should probably have this move breaks and stand and move about more frequently, more towards the center, as that's very, very important. And we've kind of said that already. But again, let me know in the chat box there, do people sit like this? You know, what's commonly done? And really, you know, is this sustainable? In my opinion, this is not a sustainable position. Again, my job is not primarily to be seated at a desk, but if I have to spend even a short time at the desk, I won't be able to sit in this posture for that long. Your work from home environment mightn't even allow you to have, you know, optimal monitor, chair, desk. and all that kind of stuff. So what I'm trying to get at here is that it's okay to sit in different postures. It's okay to slouch in the chair. It's okay to lean to the left. It's okay to lean to the right. A lot of people are even standing up these days, and that's totally fine as well. The issue is the same posture, sustained posture for periods of over and over and over again. I'm sure if you even sat in this posture for 9 hours a day, we might run into problems. So again, this is optimal positioning. If you can sit like this, great. But if you sit in other positions over time, don't be too concerned about sitting in different ones. Just make sure that you mix it up regularly. Okay, so here we have a typical day, kind of Homer Simpson style. He drives to work, he goes to work, drives home from work, spends time sitting on the couch with the family. Now, Homer is definitely not the kind of person that most people probably aspire to be, but we can make a good point from this. If we were to hand Homer over to the Department of Health, do they think that he is doing the recommended amount of exercise, and would they need him to be more active? If we take a work from home environment, for Homer, he's probably even doing less. He's not even leaving the house. So again, it creates a few more problems for us. So again, going by kind of government international standards, if we add 30 minutes of moderate intensity activity into Homer's routine, technically he is active. But I think we can do better than this, okay? Adding in 30 minutes of exercise doesn't really make a huge difference to our routine, but we can definitely stretch that out throughout the course of the day. If we're not commuting, we can get up, we can get out in the morning, hopefully. It might even be a little bit of exercise around the house. We may even be able to take a little bit of a longer lunch. The main point here is that you just need to fit this exercise in moderation around your schedule to what suits you and to what you enjoy. But more importantly, if we can space it out and get a little bit more movement throughout our day, that's going to be the best thing. Okay, so lots of different stuff about problems. Let's get on to some of the solutions. So the first thing that we're really looking at here is in relation to adding more movement throughout the course of the day. And like I said, this doesn't have to just be resistance training, stretching. It can be whatever you enjoy to do. It can be an online class. It can be a walk outside with your friends or your family. It can be going and meeting someone for lunch. But the benefits of this movement throughout the day can dampen down your nervous system and even help reduce pain. We're going to move on to talk about the Pomodoro technique. And I don't know if anybody in the past would have heard of the Pomodoro technique, but I'll give you a brief introduction to it. So the Pomodoro technique is a time management method developed by Francisco Cerello in the late 1980s. The technique uses a timer to break down work into intervals, traditionally 25 minutes in length. These are generally separated by short breaks, and each interval is known as a pomodoro, which is the Italian word for tomato, after the tomato-shaped timer that he used, which I have in the picture here. So there's 6 steps to this technique. First step is to decide on your task, set your Pomodoro timer, again, traditionally to 25 minutes, work on that task for the 25 minutes. When the timer rings, end work and take a short break, 5 or 10 minutes. That's all it needs to be. After 3 Pomodoros are done, take a longer break for 20 to 30 minutes. Once you've taken that longer break, you can go back to the start and start to repeat your Pomodoro cycles. So using this strategy will ensure you don't get stuck in that washing machine cycle of sitting at the desk all day, getting caught up in your lots of work. And obviously, there'll be days where you're on longer calls, you can't get away, but this is no harm trying. Okay, so again, just to touch on the benefits of exercise. From an anecdotal point of view, what I certainly see as a physio who has worked in the public setting, the private setting, going back to what Kelly's Tourette is, we're definitely seeing more office workers than manual laborers, and even recently more so than those playing sport potentially. We've all probably heard the theories around running is bad for your knees, lifting weights is bad for your back and joints, but all of these have proven to be untrue, which I'm sure most of you are aware of. To use running as a simple example, exercise has profound benefits, and I've listed a few on the screen there, such as relieving stress, losing weight, improving your overall health, reducing and even eliminating depression, preventing some of the diseases we mentioned, and boosting your brain confidence. Okay, so a little bit of a practical element for here. For this part of the presentation. So if you want, you guys are more than welcome to turn on your cameras. You can try these along beside me. I can give you some feedback. If you don't, no hassle. I'll give you guys a couple of demonstrations. And again, just to highlight, at Resync Physiotherapy on Instagram, we're posting videos probably a couple of times a week on posts and also on our stories. So you'll get lots of good exercise ideas there in relation to what you can do at home. So these ones are what I've kind of gone for, is ones that are essentially at the desk, because I'm not going to drag everyone into a gym or anything right now. So these are exercises that you can do in your chair at your desk if you can't get away, ideally for those kind of 5 or 10 minute short breaks, or even if you're on a call where, you know, your camera's not on, like some of you guys now, and you want to just get a little bit of movement in. They all kind of revolve around our spine and our hips and our low back as well. So the first one, just a little bit of rotation. You're looking to lift up, feel side stretch down through the arm side that is elevated. And you might hold here for just 10 seconds or so. And then you'll go try the other side. This is good for me. I haven't been in the chair for the last half an hour or so before this. And we'll go the opposite side. And again, back to here. Second one from the side. I'd probably dip out of the camera, but you can see in the picture there, you're reaching down towards the floor, feeling that stretch through the lower back, getting the hands down. Again, you might repeat that one 2 or 3 times in a row. We also have some rotational exercises. Reaching over the back of the handle. If you come towards the front of the chair, see if you can get your hand towards the back of the chair. Look over your shoulder and opposite shoulder. Go once more to each side. And then lastly, as the front of the chest can get very tight, if you go hands behind the head, elbows can start together and pulling apart. And again, you might even do a bit more of those very simple exercises, 5 or 10, but force you to sit upright, open up the front of that chest. I also have my trusty resistance band here. I get a lot of my clients and athletes and patients to keep a resistance band on their armchair or within arm's reach. So again, if you're sitting at the desk and you have a couple of minutes, you can keep your elbows by the side, just pulling the band apart. Again, opens up that chest, gives you a little bit of resistance in the shoulders to help maintain that shoulder health, keep the muscles of the back firing. So you can go elbows bent there. We can go elbows straight. Pulling the band apart again, controlling it back in. Don't be letting that band snap back on you. And then the last one, if you can bear with me, I'm going to tie a very quick loop into my band here. And these 3 I actually shared to our Instagram today. So you'll be able to see those on our Instagram feed with a bit of a description there as well. And I'm performing them there. Get a little bit of a loop into the resistance band, loop it around the wrist, create a little bit of tension with the wrist, and then just try and press up and press down. And that's a great one for getting those shoulders firing, getting those muscles up, the upper back working. That can kind of just spend a little bit too much time relaxed throughout the day as we lean forward on that desk and fall into that rounded posture, rounded position. So there's a few simple exercise ideas. If you guys have any questions, again, dump them into the chat box there and we can chat about those, or we'll get to them at the end as well. And remember, if all else fails, we always have walking, right? So you can't be just getting out into the into the countryside or wherever it might be, even around your estate close by, go out for a walk with partners, kids, grandparents, dogs, whatever it might be. Walking is always a great option, great for your cardiovascular health and to keep everything moving. Okay, so just to get into some of kind of more physio specific stuff in terms of why you might come to see a physio, right? So we can talk about treating the cause of your symptoms or pain or providing symptomatic relief. And that might be through passive treatment, where the physio does some manual therapy or stuff for you, or a little bit more active. And look, there's many different elements to physiotherapy. Passive treatment might be some shockwave therapy, some soft tissue massage, even some dry needling, which can help reduce, improve, and cure your symptoms. But then we can also have a little bit more active approach where we maybe perform a battery of tests to determine the cause of your injury and then prescribe maybe an individualized exercise program to ensure you build a robust body that can cope with the demands of, whatever you come across on a day-to-day basis. How physiotherapy can help you. Here at Resync, we've developed kind of a 6-step system to help you get back onto your feet. So the first thing that we do is we try to listen to everyone. We listen to their story and gain a perspective of what's been going on in your background and your history. We assess your injury and your movements and look for any compensations, weaknesses, differences from side to side that may be reducing your ability to heal or perform whatever your day-to-day task might be. We perform some hands-on treatment to relax, reduce muscle tension. As I said, it might not always be hands-on. It might be some of our other modalities that we offer here in terms of electrostimulation or the shockwave, if it's appropriate for you. We definitely want to strengthen muscles and joints around your body, as that gives us the best level of longevity and allows us to restore normal movement patterns as best we can. And then finally, as I mentioned, we want to build resilience and robustness into your body so you can prevent that pain recurring and get back to what you do best on a day-to-day basis. I think somebody might have their mic on that I have a little bit of feedback. Maybe if people can just check if their mic's on there and just make sure they're off for the next minute or two, and then we can open the floor. But just in summary, physio can help with both any kind of injury, really, to help you transition back to exercise. At Resync, we try and do things just a little bit differently here, right? Not just helping you to be pain-free, but to ensure you build up resilience and that your injury won't return. We have a few different packs, something like 4, 6, and 12 weeks, which allow us to closely monitor your progress and guide you through your rehab timeline. Overall, I suppose, from the beginning of the presentation, is sitting the new smoking? Not really, but there's definitely a lot of different changes that we can make to our day-to-day lifestyle, and there's a lot that we can do at home from our exercise point of view, whether that's some very simple, short exercises at the desk to getting up and moving and getting away from the desk and spending a little bit more time outside, even to developing a gym routine where you're going and you're training or you're playing organized sport a couple of days a week. So thanks everyone for joining. I know that might seem relatively short, but we didn't want to keep everyone for too long at this time of the evening. I'm definitely conscious that people probably spend most of their time at their laptops over the course of the day. So maybe the last thing we need is to have another hour at our computers. But I'm happy to answer any questions. I'll stick around here if people want to either ask in the chat box, or you can turn on your camera. You can ask me, we can share ideas and answer any questions we might have. I will just plug us once more that you can follow us on Instagram at Resync Physio. We have loads of great exercise ideas and updates there. And you can check out our website. We have loads of good resources and blogs around various injuries there. And you can also pay and book online for any of our service. So thanks again, everybody, for joining. I hope you have a great weekend. And if you have any questions, like I said, throw them into the chat box, or you can just turn off your mic and ask me, and I'm more than happy to answer those now for the next 10 or so minutes. Thanks, guys. Thanks for the feedback in the chat box there. I'll hold on again, just if there's a few more people hanging around. If there's questions, let me know, but I'll hang around until everyone's gone.